If we talk about social policy within a UK context, what does that really mean for determining policy?
Well, again, it's an interesting question because I think that a lot of people, particularly first coming to study study social policy, they might think about it, as I said before, about it's what the government does. It's what government does for us and to us in order to improve our welfare. And by government, they probably think that we're talking about the UK government at Westminster, the MPs elected in Parliament and the civil servants who work for them. And of course that is part of how policy is developed and how policy is delivered. We do have a government in Westminster and they are very powerful, although of course there are also actors that influence what happens in the UK. We're a member of the European Union and decisions taken in the European Union can also influence policy development within the UK. But actually, within the UK, it's quite a bit more complicated than just what happens at Westminster. For a start, particularly in this new century, particularly since 2000, of course, there's been a significant move to devolve elements of political responsibility and indeed lawmaking and policy making to the devolved administrations in Scotland, Wales and Northern Ireland. So there's now a Scottish Parliament, there's a Welsh Assembly government, and they've now just recently reconstituted a Northern Ireland Assembly. And they have quite a bit of autonomy over some aspects of politics and some aspects of policy development. And in particular, actually, some of the key areas of social policy have been devolved to those to the administrations in those countries. Health, education, and housing, social care, for example, are predominantly devolved to those administrations. And what we find actually is some quite significant differences have developed north of the border in Scotland and across in Wales and Northern Ireland. For example, in Scotland there are no upfront tuition fees for students attending university, which there is in the rest of the UK, and there is free long-term care for the elderly. In Wales, they've just abolished prescription charges. There are no prescription charges for medicines in the health service in Wales. And in Northern Ireland, something of a contrast perhaps, they still have a selective secondary school education in Northern Ireland. There's still an 11 plus and deciding whether children go to grammar and secondary modern school, although it's possible that may change. So devolution is an important dimension, and increasingly actually we can't study social policy in Britain anymore. We need to study it in the different areas. But there's another sense in which it's not just what happens in the national government at Westminster that matters, because there's another sense in which power is devolved and policy making is devolved within the UK, and that is the importance of local government and the role of local government in developing and delivering some aspects of services. And in fact, if you take a slightly longer term historical view of this, if you go back over the last 100, 150 years of social policy development, what you find is that an awful lot of the key elements of social policy today, public housing, public health, public education, were actually developed not by national and central government, but by local government. Interestingly, we're sitting here at the University of Birmingham. The city of Birmingham was one of the cities at the end of the 19th and the beginning of the 20th century that pioneered an awful lot of the local development of welfare provision. And Joe Chamberlain, who was the mayor of Birmingham at the end of the 19th century, was a key figure in the development of local municipal-based policy development. And local government still does remain an important both developer and deliverer of welfare services. Most of school education and most of public housing, for example, is administered at a local level. And so it's not just what happens nationally, as it were, subnationally in Scotland, Wales and Northern Ireland and England. There's also the importance of local dimensions. So when we're studying social policy and social policy making, there are a number of different dimensions within the country which we need to pay attention to. And it's also what makes it interesting, actually, because of course policy is happening, right here in this city, and you can go along and attend the council chamber, you can watch the debates, and students can see the policy making process.